Good afternoon, everyone, and we are at the top of the hour, and I just wanted to thank you all for joining us today for the SleepCharge webinar to see a live demo of SleepCharge featuring duration, timing, and quality. I'm Megan Brooks, Director of Marketing here at SleepCharge, and I'll be your MC for the event today. First of all, I just wanted to go over some really quick housekeeping items for our event. This event is being recorded, and we will be sending it out by email in just a few days. There'll be no need to re-register. You'll just simply get a link via email to share the presentation. Your lines are currently muted. However, if you have questions, don't hesitate to type your questions into the chat box, and as time permits, we'll answer the questions at the end of the webinar. For the questions that we don't have time to answer, we will respond to you directly after the webinar. So don't worry if your question doesn't get answered or we run out of time. At SleepCharge, we believe in healthy sleep for all, hence our tagline, and we stand behind it. We are a complete sleep solution for your employees. Our personalized program is convenient, easy to use, and we facilitate a discussion about sleep and health that engages your employees with the knowledge and personalization to ensure better sleep. SleepCharge by Fusion Health is really a comprehensive end-to-end sleep solution that includes everything from sleep education to restless leg syndrome care, family sleep support, sleep apnea and breathing care, and even stress and emotional management sleep support. Our solution brings technology, science, and validated protocols together with medical sleep professionals to create the first virtual center of excellence for sleep. To lead our webinar today, and John, you can hop to the next slide if you like, since you're the controller. It is my pleasure to introduce John Leder, our President and CEO here at SleepCharge. And John, without further ado, I'll let you take it away.
Thank you very much, Megan, and good afternoon, everyone. Thank you for taking time out of your busy schedule to spend some time with us. Today, for those that may be new to Fusion Health and the SleepCharge program, we wanted to take a second to step back and explain a little bit further about who we are. Megan mentioned a lot about who we are for our clients, but I want to talk to you about who we are for our participants and what they experience. Then we're going to get into sort of the meat of this thing to talk a little bit about our DTQ algorithm that we launched in this past week. It is duration, timing, and quality of sleep, and talk a little bit more about what that means to our participants. Lastly, we'll take a little spin around some of what we're currently in development on for future releases, but also things that are currently live with our DTQ launch this week. And then, as Megan had mentioned, answer any questions if time allows. Oh, hold on a second. Oh, hold on a second, folks. Forgive me. There you go. Let's talk a little bit about who we are, a center of excellence for sleep, as Megan had mentioned. But for our participants, we are truly one place to go, a place where they don't have to necessarily navigate the healthcare system and learn about sleep and any sleep conditions that may exist on their own. We're there to help them. And it really all starts with awareness and evaluation, or as we call awareness and engagement and evaluation. We're going to talk a little bit more about that today and what that means for a user or participant for us. Awareness and engagement for us as we enter in a program with our clients is really about creating a big splash with their participants, their health plan members, their employees about sleep, to talk about, in simple terms, what does it mean to sleep? We all want to sleep. We all want to get proper sleep. It's as essential as breathing. So for us, it's about creating that engagement with participants or members of a health plan for our clients, and really talk about your duration, timing, and quality. And that's done through our checkup first, which we'll talk about in a moment. But it's important to also note that we collaborate within our client's culture, within a disease management program or a wellness program that exists up front, a digital navigator program. We're very linked in, connected with those folks, so that we can provide resources for them. And in the occasion where we're dealing with someone that may need their help, where we can bidirectionally get some folks back to them. It's very, very important for us to socialize the conversation about sleep with our participants and our members, and explain to them what it is. And that's done in the second part of this, the evaluation, the checkup, which we're going to talk a little bit more about. But it's really about establishing, how am I sleeping? What does this mean to me? Guidance is the third step, and that's really, to us, a really important aspect of what we do. It's providing personalized human support, meeting people where they are. If they choose to chat with us, use technology, that's fine. If they want to have a conversation, they can pick up the phone and we'll show some things like that, or have telehealth conversations with true experts in their field. Ultimately, we are driving people that are in need of personal care to pathways or interventions for things that are keeping them from proper sleep. As Megan had mentioned, it may be something as simple as a behavioral change or an environmental change. Put the phone down before you go to sleep. Close the shades or turn down the air. It may be something detected or undetected that's more severe, that's a sleep disorder that we have to uncover and help people with. And then lastly, it's really about providing continuous care and sleep health management, so that we can intervene using technology and tracking and self-reporting to help someone with an issue before that issue becomes a long-term problem that keeps them from getting or staying in the care that's necessary for them to find healthy restorative sleep. So that's really who we are for our participants. So what we want to do now is talk a little bit about DTQ, as we call it. DTQ is nothing more than what has been taught in medical schools about sleep. It is about your duration, timing, and quality. So let's talk a little bit about what duration is. Duration is nothing more than how long you sleep during a 24-hour period. Are you getting your 8 hours you've heard? Typically, people require 7 to 9 hours. That's where, statistically or in studies, they show the lowest risk for diseases, accidents, and death. There are people that require less sleep. There are people, frankly, that require more sleep. But that's really the benchmark, if you will, for proper night's rest, 7 to 9 hours. We all know, those of us that have had children and have dealt with, those beginning days, those awesome beginning days of your childhood's lives, what it means to be sleep deprived, to not get the sleep, to have short sleep duration, to be sleeping in pieces or bits and pieces. That has immediate effect on performance. Sleep-wake rhythm. It's important to understand and know your circadian type, so that you can understand what your ideal sleep-wake time is. What a participant's ideal sleep-wake time is very important, particularly in shift workers. There's been a ton of work done with shift workers, people that are working when their body's telling them they should be sleeping. And what study after study shows is that we see higher rates of disease like cancer and heart disease or metabolic disease, and even mental health problems for those people that are awake during times when their body's telling them to sleep. There are things that you can do to help people sort of adjust their circadian rhythm, and those are the things that we work with people to do, because sometimes you just can't help the shift that you're on. And then lastly, and very importantly here, is the quality of sleep that you're getting. If you know that you're not sleeping well, it's a lot easier to understand your quality or lack thereof. But if you have no idea what's happening to you at night, if you may be cutting off your airways, if you're having apneic events, and you just don't know it, and you have a new normal of how you're sleeping, you may not really understand whether or not your sleep is quality sleep. There are plenty of other things aside from, say, closures for sleep apnea that are stopping you or disrupting your sleep. Environmental changes, as I mentioned before. If it's too hot in a room or the window shades are open. Behavioral things like having the computer up when you're in bed or watching television when it's time to sleep, or as Dr. Dermer would call it, in your sleep sanctuary. There are things like depression and anxiety, body pain, keeping you up at night. Those are all things that are interrupting your sleep cycles and preventing you from reaching those restorative phases of sleep. We know that even just one night of sleep, poor sleep, it's gone. It affects your mood, your concentration, your memory, and even things like your immunity. Sleep quality is extremely important and an extremely important part of making sure that you find healthy, restorative sleep. So what we want to talk a little bit about is, how does this render for our users? What does SleepCharge mean for a user when they begin the journey to sleep? Beginning the journey to sleep is nothing more than engaging with the sleep checkup that I had mentioned before. It's a quick checkup that helps you determine what your sleep fundamentals are. What is my timing, my duration, my timing and quality? What does it mean to me? It's immediate feedback, and it's designed to build and educate people and to create a relationship with them. This is what you've told us. This is how we can help. Providing feedback to people to let them understand the basics about their sleep. And it also allows them to have an avenue to talk to us in the manner in which they want to talk to us, or frankly, to socialize it with others without having to discuss, hey, by the way, I think I have sleep apnea. How about you? That's what the sleep checkup is truly designed to do. It's a very quick checkup. We won't go through it today, but it's about 5 minutes of time that's very quickly routes you through and is allowing us to work with you based on what you've responded to talk about your DTQ. At the end of it, you receive your personalized sleep charge, your personalized duration, time, and quality. Again, we're explaining as when we've marketed pre-launch or at a launch in a program about your DTQ and how long you sleep and when you sleep and how well you sleep. We're now bringing back to you in a very personalized manner what it is for you, what your sleep charge is, your DTQ. So for this person, we're going to talk about duration, and this is the conversations that we're having. This person's not sleeping enough. If you remember, we talked about duration, the amount of time that you're sleeping. What we're saying is, you've told us that you need some work, the amount of sleep that you're getting. But if you were to choose, if you were to get the sleep that you wanted to get, the preferred sleep time that you said you'd like to sleep is very good. We can help you improve your sleep duration. So it's beginning that sort of social contract with people to discuss their duration. Second, it's this person's timing, almost there. 75%. Your responses indicate your sleep timing is not synced for proper rest and recovery. We can help you with that. And then lastly, quality. Based on your responses, your quality needs immediate attention. So for people that are showing signs of quality issues or qualitative issues with their sleep, we want to be a bit more direct with them to say, we're going to work with you to work on this quality issue that exists with you. One of the things that I think bears mentioning here is that we've learned from our participants that providing them a sleep charge number, as we had, or a sleep score or a sleep number in your mattress. What does this all mean to me? What does it mean that I'm a 2 of 10? What does it mean that I'm a 60 of 100? We have found that, and that's why we brought out DTQ in this manner, that by truly providing the what's behind the numbers and breaking it down for people allows them to not only be educated on their own sleep, but to seek resources and to seek help. And that's really where I'd like to just explain a little bit about the people that sit behind all of this. We're not just a mobile application that is self-paced or self-directed. We really exist to provide educational resources through expertise and, frankly, intervention resources and solutions to provide people with the necessary tools to find that healthy restorative sleep. The group of folks that runs this or that sits behind the scenes that work with a participant when they want to have a discussion about what their quality issue means, or when they want to find out more about what this next step may be. These are experts. They have backgrounds in social work and behavioral expertise, psychology, but they're also folks with clinical expertise. Respiratory therapists, registered polysomnographic technologists, sleep-boarded physicians, all coming together in a manner that allows us to triage people through the process and provide them the resources that they need. Another thing that's very important to note is that our program is not just built for those in need. That's a natural tendency that we all have. But there are people that engage and want to understand how to optimize better. They may be good sleepers, but want to be great sleepers. That support exists for those just as it does for those in need. So it's a very important aspect of what we do and how we do what we do. But these are the experts that help make us who we are. These are also the experts that when someone is in care are handling the issues and handling the concerns that someone may have in a proactive manner along with them to keep them on a therapy to help them with the tough times and to get them to the results that they need. And those results, frankly, for our participants are better health care, better overall health, better well-being, better quality of life, more productivity, more present, things like that. And for our clients, all of those things help to have better retention, to have more engaged populations, more engaged members and participants of their corporate community. But additionally, we're able to show our clients the true savings of providing this resource or these resources for people and the relationship between poor sleep and disease and the true bending of the curve that can happen when you intervene on behalf of people and get them into the proper therapies to sleep well. Okay, so that's a little bit about how it works, what it means to our participant. I wanted to kind of step back for a second and show you all a little bit about some of the things that we have within SleepCharge, within the SleepCharge portal, as we call it, for our participants, as well as some of the things that are in development for our participants, because it's truly about those participants. So Jack is our participant here. And this is Jack's homepage. And what you see on the left is sort of where Jack is in his journey, his steps, the things that he's done. Jack's taken his sleep checkup. So he has his sleep checkup. He can explore the full report. He can see it. It sits there for him forever so that he can go back if he gets onto a therapy or needs a therapy and is diagnosed with an issue, that he can go back and see his starting point so that he can now compare and really not only sort of self-report, but have that gratification that this is working for him. And these things help along the way, particularly when you're having those tough times, to see the little incremental changes that are making things better for you. On the right is a perpetually changing as Jack moves through the process, some of the things that he's able to Garner to see. He can fill out his sleep journal, and we'll show you that in just a moment. He can take his synchronized program. He may be at risk for sleep apnea and restless leg syndrome and needs a sleep test. So he can check the status of his sleep test, where it is. He can get his results. He can see the full results of the sleep test. He can also have a conversation with a physician or with a clinician or a care manager. He can also educate himself about the risks, the symptoms, and the signs that exist for those risk factors related to restlessness or sleep apnea. So he has the ability to educate himself along the way. Additionally, Jack has the ability to have a resource center that we call My Sleep. So it gives him the ability to track his sleep. Okay. He has the ability to enter a fitness tracker. If he doesn't see his device there, no problem, Jack. You have the ability to fill out a sleep journal. Make an entry into a sleep journal each and every day, or when you feel that you need to, submit that sleep journal so that you understand where you are in your journey. Okay. He also has the opportunity here to educate further. Welcome. This is where you're going to find the resources that you need. Things like consistency is key. Remember, we talked about timing, making sure that we establish a regular schedule. Just little things that may have further help Jack in his journey to sleep. Light excites, and yes, even for SleepCharge. Put down that screen, get away from it. Artificial light an hour before bedtime needs to go away. Learn more. He can also look through articles that may very possibly match up with what he is feeling or needs, or she, whomever it may be that's participating. So they have the ability to interact in the My Sleep area. Again, I showed you My Sleep metrics, and this is really about using as much data as possible within our platform, whether it be an accelerometer device, a PAP machine that speaks to our technology platform, self-reporting or tracking, or any other devices that are there that won't bore you with, but really effectively allow Jack or Jane or whomever it is to see how they're doing. I benchmark my duration, time, and quality. I get to see when I'm sleeping. What is my variability? What does my duration, timing, and quality look like over time? How am I doing as a participant in this program? I also have the ability, again, as I want to communicate, to talk to people. It might be about a result, something that I'm seeing, something I agree with, something I need help with, whatever it is. I have the ability to have a conversation with, in this case, Michelle from SleepCharge, to interact via chat. And if that's something that works for me, we have people that really, they want to speak to someone. They want to have a conversation. They can do that. They can simply just call in the number, click on and have a conversation, set up an appointment, talk to us about what's going on. There's a lot of ways that people can communicate with us. Our goal ultimately is to meet folks where they are, meet participants where they are, in the manner that they choose. Some people choose to speak to you through technology. That's great. That's fine by us. We meet you where you are. Okay. You always have the ability, Jack always has the ability to go back to his home screen, see what's new, and all of those wonderful things. He can also look at his notice of privacy. He can look at his insurance data, all of those great things that live inside of the SleepCharge platform. Okay. So that is the SleepCharge portal. And I just wanted to take a couple minutes to reiterate, really ultimately and importantly in this group, that the journey begins with your duration, time, and quality. It doesn't end there. That is the engagement mechanism, the awareness that we're creating so that people can socialize, so that we can build a social contract with a participant or a member and talk to them about their duration. How long are you sleeping? You know, when are you sleeping? What are the things that we can do to help you sleep on a consistent or more consistent schedule? And ultimately, how well is it when you're getting that sleep? How well are you truly sleeping? What is your quality? And how well are you ultimately sleeping during your regular sleep cycle? So in closing, We are about creating awareness and engaging with a population, beginning the dialogue and continuing the dialogue about sleep in a manner that allows people to easily talk about something that is essential, again, as oxygen. Then it's really about getting people to the right interventions without them having to navigate a very frustrating healthcare system, particularly in sleep, to get the resources that they need, regardless of what it may be, whether it's a sleep apneic that needs PAP therapy, or an RLS patient that needs iron therapy, or circadian rhythm disorder patient that needs light box therapy. Those are things that we provide for people. It may be as simple as a behavioral change that's necessary. So providing people resources and education to get there and solving those issues. And then most importantly, providing continuous care. Being there for people when they need you, and more importantly, using the latest in technology to catch things before you even know that this issue is persisting. So it's really a great way of proactively reaching to people, caring for them, providing them the resources and the therapies necessary for them to find healthy sleep, and for us to ultimately fulfill our obligation of healthy sleep for all. So that ends the formal portion of this. So Megan, I'll turn it back over to you.
Sure. We have had a few questions come in, John, so let me just bring them up here on my screen. Okay, the first question is, does SleepCharge actually have people for participants to speak to, or is it an automated system?
SleepCharge participants within our company, yes. Specifically, if the question is, are there folks within our company that they can speak to? Absolutely. That's what we're built on. It's the ability to have conversations with people, again, meeting them where they are. Some people would just prefer to chat with you. Some people want to have a conversation. There are people that want to have a conversation with a physician to talk about a diagnosis. Those are real people that are on the other side of that computer screen or that phone or that telephone line or that chat function. So yes.
Okay. The next question I have is there a phone app that goes along with the SleepCharge program?
There is. This is web development that works via mobile as well as desktop. So yes.
Another question I have that has come in is, what conditions does SleepCharge actually cover?
That's a great question. You know, there are times where we will actually, this is where, as I mentioned earlier, the disease management, the collaboration that we have with our clients, the more we can benefit our participants, the better. So there are conditions that we may not be able to solve, particularly in the world of sleep. A narcoleptic, for instance, they take constant physician supervision. But we will work with an accredited narcolepsy expert, accredited sleep center in the country for that person to get the care that they need. For us, we started handling obstructive sleep apnea, which is where we really truly cut our teeth because it is the most costly and really, from a disease impact state, very, very tough on people. We started there. We expanded into therapies for insomnia, and we are expanding in 2019, the beginning of 2019, January, to provide therapies for restless leg syndrome and circadian rhythm disorders for folks, as well as other disruptions, and connecting them with resources within a health plan to get the care that they need. For instance, if someone is not sleeping because of pain, we have the ability in some of our clients and most of our clients, frankly, to connect them back into the health plan resource that's necessary for them to get that back pain fixed so that they can sleep properly. So it's really about having a conversation about health, but having a conversation about health through a very simple discussion point, and that is your sleep. So hopefully that answers it.
Sounds good to me, John. That looks like all the questions we've had that have come in, and we are actually at a half past the hour, so we're right on time to keep in alignment with everyone's busy schedule. So from our team, we thank you so much for joining us and participating today. And John, do you have any additional closing remarks?
No, I just want to echo what you just said. Thank you so much for taking time out of your busy schedule. And we're here if and when you all would like to talk or any sort of follow-up that you may have. We'll get back to you as soon as possible on any outstanding questions. Thank you so much.
Thank you, and have a great day, everyone.